So I think I introduced myself. I'm Dr. Mary Schmieder, the other Dr. Schmieder's wife, okay? And Robin has such vibrance and brilliance. So I guess what we've been asked to do is try to give you kind of an opinion that, you know, what we're thinking when we look at your face. When we're looking at Robin's face, what do I see? As a physician, I see vibrance, I see beauty. It reminds me that, you know, all creatures are created differently. She has beautiful bone structure. She has this really beautiful colored hair and blue eyes, but she has some signs of being on our planet for a while, okay? So we want to soften what she has, okay? So we don't want to change her. So Robin and we've talked about her goals and what I think. So Robin, can you frown for me? So she has these lines, okay, and we refer to those as 11s. You see that in the media. And she has these we refer to as crow's feet, okay? And she has some lines here. And can you purse your lips a little bit? So she's got some signs of wrinkling around her mouth. So we want to soften those. And there's a little bit of, just bring your eyebrows up for me. Okay, so a little bit of wrinkling here, right? Okay, all right, so I know, and what we usually talk about is the fact that this is a really nice place and we have hors d'oeuvres, but this is not a Botox party. So everything here is, as you can see, we've already talked to her, we've taken her medical history, we've logged our medications, but we do try to make it look nice for you. So Botox is a neuromodulator. So what we're going to do is we're going to give her medication to try to relax the muscles that create those. There are several neuromodulators. The one we use is Botox Cosmetic. There's Dysport. You've heard about that. I know there's some physicians in the audience. Dysport reportedly lasts a little bit longer, maybe a little bit cheaper. I don't know, but it's not really been around as long, so we're still using Botox Cosmetic for our neuromodulator. So that's what we're going to use tonight for Robin. We took some pictures of Robin, so this is her before, and this is kind of what she looks like, and this is what we've been talking about. What I like to do is I like to talk to the audience a little bit about just a little bit of education. And so you already had the, I guess, the filler demonstration with George, so you already saw the size needle. And so what I like to do is educate you as a consumer. So if you decide to get Botox here or not, I think you should be educated as a consumer. And if you see this size needle, I think you should think twice. And this is just my personal medical opinion. I think that Botox, as a neuromodulator, is a powder that to become injectable needs to be made into a solution. So if you see this size needle, I get concerned and I would maybe reconsider. And the reason I say that is because I think that bigger needles hurt more and they have the potential to cause more bruising. And I don't think you need that much volume in the small muscles of the face. Does that make sense? So just to give you an example, this is the size needle that I use for Botox. Do you see the difference in that? Very big difference, not in just the syringe, but in the needle size. Okay. Now, you'll see a lot of different syringes because I like to use different syringes because I think that each needle, if it's individualized, is sharp, and sharper needles cause less pain, okay? But they can, all the solution can be in one small needle. Okay, so that's the first thing I wanted to teach you. So are we gonna inject you tonight? Okay, so here's a little icy, okay. Ice is the oldest painkiller, and so we're gonna have her ice. Now, I am obligated to tell you that Botox is approved for the glabella. This is the glabella. However, we do use Botox in the crow's feet, we use it in the forehead, we can use it in the lip, we can use it in the muscles that depress the mouth, and we can use it in the neck. Medical uses of Botox are for excessive sweating, hyperhidrosis under the arms and the palms, and they are coming out with a topical use for that, which would be a lot less painful. And of course, in the pain management sector, the neurology sector, we use it for trigger point injections, migraine headaches, and cerebral palsy, things like that. We use it for blepharospasm for the physicians in the audience and for other kinds of spasms of muscles. So, but here we're using it for cosmetic purposes. So, first we're gonna wipe her off and then we're gonna ice her down and we'll start to do the demonstration. The second thing I usually tell people is that I think you should be very careful who you allow to inject a neuromodulator into your face. And the reason I say that is because what we're gonna do right now is gonna be seemingly quick and easy. However, it takes a long time to get there. And I think, if it was something that anybody could do, then it would be like going to the internet and looking up appendicitis and appendectomy, and then thinking that anybody could just look up that procedure and take out your appendix. I think that's foolhardy. And I think you should know who is injecting a neuromodulator into your face. So even though it seems quick, it took me very many years to be able to do that, okay? So it's a medication, and of course we only use the approved brand, et cetera, et cetera. And I think that the third thing I should tell you is that our preference here at Park Avenue Dermatology is to assess you medically, see how much, and we use the arm muscle analogy again, see how much medication it would take to relax your muscle in particular, because one size doesn't fit all. So it would be foolish for me to say, well, Robin's bicep muscle is the same size as Arnold Schwarzenegger's. So it would take more medication to relax her muscle in her arm. So we don't do that one size fits all pricing, okay? So I make a medical assessment and then the nurse figures out what it will be. So we charge per unit, that's our preference. Other people don't do it that way, but that's our preference. And I think, if you get a special, just look at it carefully and just say, well, doctor, is that gonna relax my particular glabellar muscles? Because if it doesn't, then what good is it, okay? So the idea is relaxation to prevent the furrow, okay? All right, so all right, now you sure you're gonna be?
Oh yeah, I'm fine.
Okay. So we asked her all about her allergies, her medical history, and let's just, for the sake of the demonstration, let's just do this area, okay? All right. Now again, if you go to another physician, they'll do it differently. If you lined up 20 physicians, they'll do it differently. This is our particular way of doing it. Okay. All right. How do you feel? You okay?
Okay. Mm-hmm.
Okay, I'm gonna go right there. There. The magic of Botox. How do you feel?
Okay.
Did it hurt?
No.
Okay. Of course, she has to say that, I guess, because she's here.
It doesn't.
Okay. What I've done is I've examined this patient previously. I've had her furrow and make some motions with her face, and I've determined from my expertise and having done this for quite a while, how much I think it will take to relax her. Now, I also should tell you that unlike the filler demonstration, the effect will not be immediate. You'll get some sort of an effect in a couple of days, but the maximum effect will be achieved in 2 weeks. So if a patient is not fully relaxed, I ask them to come back to me in 2 weeks, and I may put a little bit more in because it's not an exact science. However, I don't like to wait too much longer because then it starts to, get into the next phase. Botox will last anywhere from 90 to 120 days, and then they start to see more relaxation. Now remember something, you don't want the muscles of the face to be completely paralyzed, do you? You don't want to look like that movie with the Christmas people and hi, honey. You want people to say how nice you look. You don't want them to say, oh my gosh, have you had a neuromodulator? Put in your face. Okay. All right. So now bring your eyebrows together again for me. Relax now. Okay. So here we go. So now, again, every physician will draw up a little bit differently. Every physician will, George and I don't even do it the same way. So many units. I like to do it this way because I like to do everything my own way.
It's just like writing. Everyone has a different style of writing.
Yes. I'm board certified in emergency medicine, pain medicine, and aesthetic medicine. I also studied acupuncture. I am a needler, so I'm really particular about my needling, okay? So I think that this hurts less. Does this hurt? Again, I'm actually in control here, so she probably has to say that, but okay. All right, so we're gonna do, let's see, we need a 5 here, right? So I picked up a 4. Okay. But remember something, a carpenter needs to know their tools. That's what I'm trying to tell you. And if they don't, be smart, get up and say, I don't want to do this, because it's not an emergency procedure, is it? Okay.